In this audio lecture, we're going to be covering the manifestations and diagnosis of um, cancerous neoplasms or malignant neoplasms. So, covering the manifestations first, and then we'll get to the diagnosis. Clinical manifestations for cancer can include a change in bowel or bladder habits, a sore throat that doesn't heal, unusual bleeding and discharge, a thickening or a lump in the breast or elsewhere, okay? Indigestion or difficulty swallowing, obvious change in a wart or mole, nagging cough or hoarseness. A helpful acronym that can help you remember these are CAUTION, right? Um, these are all kind of vague manifestations, but they are helpful, especially when uh, present. So the blood, for example, blood in the feces or blood in the urine um, is sign of concern. So you should be getting that checked out. Or if you have a lump in your breast, you need to be checking that out. Um, Indigestion alone is not really a manifestation of cancer, um, but if it's combined with difficulty swallowing, it might indicate some esophageal cancer or either gastric cancer. Obvious change in a wart or mole is kind of obvious. Anytime you have squamous cell changing in appearance rapidly, that could be an indication of skin cancer. Nagging cough or hoarseness, right? So these are indications generally of laryngeal cancer or lung cancer. Okay. Bowel and bladder or digestive and urinary. A sore that doesn't heal would be like a little skin wound. Okay. These are all fairly non-descriptive manifestations, but as we move forward with this and with the other disease states, we'll cover cancer and some of them, not all of them. But you can obviously see how these manifestations would present in the site. So it's all going to be site specific, the manifestations. Okay. Some other manifestations can include anemia, okay, which we'll cover in another audio lecture. Okay. Anemia is going to be a reduction in red blood cells and reducing the ability for oxygen transport. Cachexia is muscle wasting. So this would be a weight loss and muscle wasting. You're not going to maintain. So remember, and all the healthy cells are being starved of those resources that you need, right? So resulting in necrosis and apoptosis. Fatigue, because you have this malignant neoplasm growing, stealing resources and leaving less resources for the healthy individual. You might be susceptible to infection because of the prolonged the prolonged presence of the cancerous growth. Leukopenia. Leukopenia is a reduction in leukocytes, as you'll see in chapter 3. So leukopenia can be just due to the overpresence of a prolonged infection or even leukemia, right? So cancer of the bone. Thrombocytopenia, so this would be the abnormal bleeding that we can sometimes see as a general manifestation of that. So thrombocytopenia is going to be reduction in thrombocytes, okay? And anytime you see penia, that is a reduction of, okay? And then pain, right? Pain is not a very specific manifestation, but again, all the manifestations are going to get more specific when we talk about individual cancers. You just don't have general cancer, you get specific cancers. Okay. So how do we diagnose cancer then? Well, first and foremost, we're looking for any of those manifestations, okay? And then now we start to have some medical diagnoses, right? So we might get like an ultrasound, um, we might do some aspiration, and meaning, so this would be like an example of aspiration. So this is a thyroid gland and you have this growth and it's probably visible from the outside. You're using ultrasound guided imagery to help you direct the needle and to survey the site. And so they would send this off to a lab and grow it and look for the cancerous characteristics. Sometimes they do like an endoscopy. Endoscopy is when they pass a camera down through your mouth and your esophagus into your digestive tract. And then they can oftentimes use a little bit of excision, and so which they cut away a piece of that tissue right here, and then they would culture that and look at it. And then laparoscopy. So laparoscopic procedures are when they go through the abdominal wall. Right. So here, this female is getting, it looks like her ovary checked out. I can't tell because it's a little blurry, but in that picture, they've inserted the camera right here, and it has a light on it, and then they have this little grabber, and then they stick it through the body wall, and then they excise the tissue. Sometimes they can take out the entire tumor growth, but they usually don't want to go to take that entire tumor out until they've identified that as cancer. Sometimes they take it out if it's causing pain or discomfort. Okay. So to diagnose cancer, a thorough medical history. This is why it's important to be honest on your medical evaluations. And so when they ask you all those questions, it's not because they want to increase your insurance rate, it's because they want to look for any kind of history and activity that would preclude you to development of cancer. Right? Physical examination, so here they're going to be looking and they're going to be feeling and prodding your body, looking for growths. And then diagnostic testing, and here we can look, we will talk more specifically on the next slide. So this diagnostic testing, we're going to be looking for things produced in the body. So either taking a biopsy of the tumor or taking a tumor marker, right? So these are going to be in circulation. And so you have to be careful with these tumor markers because they aren't the end all. They can be used to help identify cancer, but as you'll see when we talk about them more, they are sometimes produced in the absence of cancer. Okay, so I think the key to this is that you use multiple techniques, and so you're going to be using X-ray, looking at the tissue thickness. So the X-rays are used for more than just detecting bones, right? So they detect differences in density of tissues, and so this would allow you to look at a dense tissue. So the characteristic of, like for example, this is cancer growth, the breast cancer. And one thing that you'll find that in all medical pictures you find on the internet, people are generally smiling. This is not my experience with going to the physician's office, right? So I'm hardly ever smiling, especially when I'm getting like an X-ray or something done. So because it's uncomfortable, and but these pictures are trying to paint the patients and health professionals in a rosy picture. Computed tomography. So these are multiple imaging techniques here that we're going to use to help identify the growth. And so the computed tomography is pretty much a 3D, it's also known as a CT scan. And so the CT scan it's a 3D X-ray pretty much. So they're taking it at multiple angles. They put you in a tube, or that's not really a tube, but it's like a circular thing, and then it takes the X-rays from multiple angles as the X-ray moves around you. Ultrasonography is using ultrasound to visualize the internal structures without actually going inside. They can look at fetuses this way, and organ structure. All right. In this slide, we have positron emission tomography. And positron emission tomography is using radio tracers or radioisotopes to help diagnose the problem. So this is showing a cancerous growth in the lungs. And it's visualized by a camera that picks up the radioisotopes. Okay. In addition to this, we can use blood tests looking for those markers, and then also manual examination looking for the growths occurring. So these tumor markers that I've mentioned a few other times now, are really antigens on the surface of the tumor cell. And so these can be helpful in screening, diagnosing, monitoring, treatment, and establishing remission. And so depending on what stage we're looking at, so screening, we're looking for abnormal cell markers. Okay. Diagnosing, the same thing. Okay. For monitoring, we want to look for either the cell markers remaining flat, the concentration of them remaining flat, or going down as the case with remission. So in treatment, they would be going down as well. So it would allow us to track the progress of the cancerous tumor. Obviously, you would want to use this in conjunction with other techniques as well. So I urge you not to say that if you present these, you have cancer, right? So sometimes they are produced in normal physiological processes. Okay. So here's a few cell markers, and I'm using these examples because they have nice examples of cancer, and then they also have examples of non-cancerous functions, right? So alpha-fetoprotein, if you find that in circulation, okay, it's an indicator of liver cancer or some sort of reproductive cancer. Carcinoembryonic antigen, okay, indicates that you might have bladder, breast, cervical, colorectal, okay, any number of these types of cancer. Okay, and now a lactate dehydrogenase, okay, is indicative of a few different types of cancer as well. Okay. Now, take these with a grain of salt because you have to use them with other diagnostic procedures. So here we have these same markers, okay, present in different conditions, right? So not cancer, so alpha-fetoprotein is a common hormone or common protein during pregnancy, right? This is actually one of the markers to determine birth defects of children, right? This is not an indicator of cancer during pregnancy. You could get cirrhosis of the liver, hepatitis, okay? All these are conditions. So my point here is take them with a grain of salt. Make sure you're using plenty of information to make these important decisions. So we have carcinoembryonic antigen, okay? That is also produced during IBS. Remember, it was a host of cancerous inflammatory bowel disease, liver disease, pancreatitis, tobacco use, COPD. All these are bad conditions, but they're not cancer. Okay, and lactate dehydrogenase. Lactate dehydrogenase is going to be present in hypoxic tolerant tissues, right? So you'll find lactate dehydrogenase in conditions that oftentimes are associated with hypoxia or reduced levels of oxygen, such as anemia, heart failure, lung disease. Okay. Liver disease is the one exception there. It doesn't really fit in there. But we see the liver produces lactate dehydrogenase, and so dysfunction of the liver, it makes sense that you might have elevated lactate dehydrogenase. So we see conditions in which you don't have cancer, but you have the cell marker. So now getting into the grading versus staging of cancer. And so we're going to be looking at, so remember that one of the key differences between benign and malignant neoplasms was level of differentiation. Remember, so benign neoplasms are usually highly differentiated, whereas malignant neoplasms are normally poorly differentiated, right? So they are highly undifferentiated, and they go through cell cycles relatively fast. And so we have stage up here and then grade down here. So the grading is going to be based on the microscopic differentiation and number of actively dividing cells. So here's the grade, okay, 1, 2, 3, 4, okay. 1 is well differentiated. It resembles a normal tissue, so this type of cancer might start to go through the mitosis pretty quick, but it's not going. It's going to maintain a function at least. Whereas 4 down here is a poorly differentiated cancer cell or tumor, and it is more. It resembles what people think of cancer more, right? So it's poorly undifferentiated. It's a cell that doesn't maintain normal function at all, really. Staging talks about tumor size, lymph node involvement, and metastasis. So this is staged on the T and M stage. So T and M stage, so tumor nodal involvement and metastasis stage. Okay. So the tumor size is going to be graded between 1 through 4. And so here are the characteristics for that. So if it's less than 2 centimeters, it's a stage 1. Okay. 2 to 4, stage 2, so on. And then the lymph node development, we can look over here, and you realize that we have unidentifiable to it is found on one side and is in one lymph node. There's one lymph node, and on one side it's greater than 3 to 6 centimeters. And then if it's found in multiple lymph nodes, it is 2B, ipsilateral, and is less than 6 centimeters. And then and 3 would be a very large tumor. Okay, it is probably all over. Ipsilateral means one side, 2 sides. Contralateral means opposite. Okay. So, and then we could go metastasis. So it's either spread or it hasn't spread. And so if it's 0, if it hasn't spread, if it has spread, it is 1. Okay. So be familiar with the staging of a tumor. All right, so here we are at the conclusion of the presentation. So next up is the cancer treatment, but here is the hot wash for the diagnosis and manifestations. So you should now be familiar of the common manifestations of cancer. Now you should be aware of why these should be taken with a grain of salt, but how they could indicate something more serious. Now specific manifestations about specific cancers will be covered later on in the course. However, the manifestations right now should be associated with the cancer somehow, especially cachexia, anemia, fatigue, right? So you should be looking for these different manifestations and the disorders that they cause. Now, how do you identify cancer using the different techniques? And so going through that slide where multiple techniques are used, usually in combination. And so why should cell markers be used combined with other techniques? And hopefully you're able to tell me right now that. If not, you have some time. And then how do you classify cancer risk scores? What are the differences between staging and grading? So that's it for this audio lecture. Until next time.